My name is Anna Beattie and I work here at 3Dental as an oral surgeon. I also work in the dental hospital as a clinical supervisor. Definitely you can treat a mild wisdom tooth infection yourself at home. I would suggest trying to clean really well around the area, and sometimes people find they stay away from cleaning around the area of infected wisdom tooth because it's sore to touch it, but the best thing to do is to clean around it well, gently with your toothbrush, and also to use some kind of antiseptic mouthwash. Hot water with some salt dissolved in it can be a very effective antiseptic. If you prefer to use something in a bottle, then Corsidol or Pericoronitis would be good antiseptic mouthwashes to use. And generally, if it's just a mild infection, if you clean around the tooth well and use an antiseptic mouthwash for a couple of days, it will tend to settle back down again. If that doesn't work, generally the best thing to do is to come and see your dentist. Sometimes people need a short course of antibiotics to really get on top of a wisdom tooth infection. It varies from person to person, and important to have a conversation with your dentist about that. But generally, we would look for people to have had maybe 2 infections around a wisdom tooth before we would take it out. Sometimes if someone's just had 1 very significant infection, then we'll take it out, but some guidelines would suggest that we'd look for 2 episodes of infection before removing an infected wisdom tooth. But again, that varies a lot based on the tooth itself, and good to discuss that with your dentist. Wisdom teeth are removed for a number of reasons. One of the main reasons that wisdom teeth are removed is because people are getting recurrent pericoronitis around the wisdom teeth. They're presenting with pain and swelling around the wisdom tooth, maybe happening 2-3 times a year, and they're needing course of antibiotics, and the best thing to do in that situation is to take out the tooth. Another reason people end up getting wisdom teeth removed is because they've got decay either in the wisdom tooth itself or in the tooth adjacent to the wisdom tooth. So when the tooth is partially erupted, it can often lie against the adjacent tooth, and people can be very prone to developing decay in the back side of the tooth adjacent to the wisdom tooth, and that's another really important reason to have your wisdom teeth checked and sometimes removed. It depends a lot on the wisdom tooth itself, how it's positioned, but generally it requires a small surgical procedure to take out a wisdom tooth. You often have to section the tooth into some different pieces in order to get it out easily, and then we'll put a stitch or 2 into the gum afterwards. If you feel you have a wisdom tooth infection, then it will be good to have this checked by your dentist, particularly if you have significant swelling in the area or if it's feeling very painful, and if that's lasting for longer than 3 or 4 days. Please visit our website at 3dental.ie where you can easily book an appointment with a dentist to have that assessed.